Hi, I'm Susan Brekelmans, and I'm a senior consultant with Benefactor Group. And I am here today with Jodi Bopp, who is a client and fellow traveler in the nonprofit sector.
My name is Jodi Bopp. I work at I Am Boundless, Boundless for short. We are Ohio's largest nonprofit provider of services to people with intellectual and developmental disabilities and behavioral health challenges. We're a statewide organization based in Worthington, Ohio, and I have the privilege of serving the people of Boundless as its vice president for advancement, which means philanthropy and volunteers.
We started working together as Boundless was preparing for a campaign. Could you quickly tell us, first of all, what the campaign vision was?
We started working together, I believe, in early 2020, late 2019. I was hired, and then Benefactor came on to help create Ohio's first healthcare site for people with special needs. So bringing together behavioral health, dental health, primary care, and pharmacy care all under one roof with the special needs client in mind.
And what led to your decision to engage a consulting partner to help plan that campaign?
I have certainly lived through a few capital campaigns. Each one is unique, but having a partner who had lived through many, many campaigns collectively as a firm just brought a wealth of information and knowledge and resources that we either wouldn't have had on our own or would have taken forever to try to find and leverage networks. And then the other thing is, especially as the pandemic hit and turned everyone's world upside down, there was no opportunity for me to take a broader scope of what is happening in the not-for-profit world in the days of 2020, what were other campaigns doing, and Benefactor provided a huge resource there. And just having that external, clear, level head was really important for all of us, especially because Boundless was going through their very first capital campaign. And so to have, the experts in the room helping me and then helping guide our senior leaders, our volunteers, our board was just critically important.
How would you describe the process that Benefactor Group introduced? And was there anything that felt different or meaningful about the way that our firm worked with you?
So what I love and loved about the Benefactor approach, even from the pitch meeting, was acknowledging the realities. So for Boundless, that meant no giving history to speak of, no database to speak of, and we were going to go from no fundraising to a capital campaign, which by and large is not the historic route one takes when you're starting a philanthropy program, and certainly not a route I had taken personally. And so I appreciate that Benefactor came in and said, there is always a way. It may not look the way you think it looks today. You may have a vision for how this is going to go, and we may tell you that that vision is not the right path, but there is always a path, and we will help you find it. We originally approached the campaign as a massive capital campaign to undergo the renovation of our entire campus. It would have been a minimum $30 million project. And candidly, Benefactor came in and said, while that is possible, it's not possible in one go. Can't eat an elephant in one bite. So figuring out which part of the elephant we were going to tackle, and that became the Boundless Health Center. And then let's tackle that first. And now, what does that mean for the rest of the campus? And I'm so grateful we tried to do it that way. Otherwise, we were setting ourselves up for failure, and that probably would have killed the philanthropy program for a while, rather than give it this wonderful start that we can then build from.
What were the most important fundraising activities for you and for Boundless in tackling that first sort of sprint of the campaign?
We're not going to talk about a comprehensive program. We're really going to focus on major gifts, getting folks ready to make that significant gift. And so at the end of the day, I think the grand total, we had 47 donors who helped us raise $2 million.
Thinking about challenges that Boundless faced during the campaign, is there one or a couple of challenges that you're most proud of overcoming?
I think for us, the couple of challenges I'm really thrilled to overcome, and we continue to overcome, is brand recognition. It is lovely now to go out and about especially in the not-for-profit space, and say, "Oh, I work at Boundless," and for folks to say, "Oh, I've heard of you." And then the other thing I'm very, very proud of is having a board of trustees who went from no giving expectation, no philanthropy committee, to really becoming the campaign committee and really owning the campaign. And they really transformed themselves in a very, very short amount of time. And I'm proud of all of us, and I'm incredibly proud of them for that. And we would not have been successful without that.
Jodi, what's next for Boundless? Where do you see I Am Boundless in 1 year, 5 years, 10 years?
Boundless is growing. When I first started, we were in Central Ohio only, and now we're statewide. I fully look for us to be across the Midwest in the not too distant future. But what I'm really excited about is not only providing really quality services day in and day out, but also always seeking those innovative, interesting, and hopefully successful ways to provide care for those we serve in a way that is better for them.
Jodi, it's been such a pleasure working with you over the past few years, and I'm just wondering, when you think about the work that Boundless and Benefactor Group have done together, what are the high points? Are there any moments that sort of stand out for you?
Yes, absolutely. We've been just thrilled with our relationship with Benefactor. Of course, the first and the biggest one is the successful capital campaign. Not only were we able to raise $2 million really quickly after starting a philanthropy program, but we did it in 2 years. I really appreciate how many of the Benefactor team are presenting at conferences, writing books, sitting on boards, and bringing the education and the research of our industry to me in a way that is useful to me. I would love to spend all that time reading all the latest studies and reading the Chronicle of Philanthropy cover to cover every issue. I confess I am not that person. I just don't have that bandwidth all the time. But I know someone at Benefactor is doing all those things, or maybe even wrote the article that is being referenced. And so I get to tap into all of that knowledge, and really it helps me pay attention to what's going on at the industry and figure out best practices without having to do all that on myself. Plus, I'll be honest with you, the Benefactor team is just fun to work with. So I just physically enjoy, you listen to me complain and go, but let's keep going, and are great for boosting my spirits when I'm feeling low. So that's not to be underestimated.
What are you seeing in terms of the impact that donors have made on the families and individuals and communities that Boundless serves?
This is my favorite part of the whole philanthropic process. What impact was made? I have the privilege of going over to the health center really anytime I'm on campus, so I am there with some frequency. And watching someone walk into the space for the very first time and having their eyes get very big, and to see a beautiful, welcoming lobby that is sensory friendly, and then hearing the patient satisfaction surveys when they've had a service, and how they appreciate how much care the staff gave them, how they appreciate that they can get all their appointments in one building, just hearing that over and over and over again. And then finally hearing from the staff. All the staff is trained that when someone is having a bad day and having behaviors that may be dangerous to themselves or others, there's a code that they call. All the staff come, they provide care to that individual. And my understanding is, in the old building, they were calling the code 2 to 3 times a week. And once we moved into the new building, almost immediately the code got called 2 to 3 times a month, and sometimes not even that often. And the only difference, the staff was the same, the services were the same, the difference was the location. And now we, thanks to our very generous donors, we have a building worthy of the program that lives there. And I'm immensely proud of that, and I hope our donors are too.